Clarissa with the Minnesota Research Link. Today I'm talking to Philip Alberti. Philip, can you tell me a little bit about yourself and what you do?
Sure. Great to be here, Clarissa. Thanks for the invite. So I am a social epidemiologist by training, and I work at the Association of American Medical Colleges, where I serve as the Senior Director for Health Equity Research and Policy and the founding director of our new AAMC Center for Health Justice.
Great, thank you for joining us. Can you tell us a little bit about the CHNAs, what they are?
Sure. So a community health needs assessment, or CHNA, is a requirement for most not-for-profit hospitals, a requirement put in place through the Affordable Care Act. And it mandates that hospitals every 3 years partner with local communities and community-based organizations, as well as local and state public health experts to do 4 things: to collaboratively assess the health needs and hopefully the local assets within a community, to prioritize those needs, to develop interventions that address some or all of those needs, and then to evaluate, to track progress to see whether those interventions are working to improve community health and achieve health equity. And this is crucial work for communities not only to know about, but to get involved in. And community wisdom is essential across all 4 of those CHNA steps.
Thanks. Can you elaborate a little bit on why it's important for communities?
Sure. I mean, who better than those living in a community to describe and define not only the most pressing barriers to health, but also to make sure that hospitals are engaging all potential partners, all community assets, to broaden the collaborative to ensure all perspectives are incorporated, right? And when it comes to prioritizing those needs, again, the community knows best, not only about how to rank order those needs, but also about what kinds of interventions are most likely to succeed, and even what that definition of success should be. As we often say in the center, those living in neighborhoods closest to health and justice are also closest to the solutions to that injustice. And so without deep and broad community engagement in the CHNA process, the work just won't be as effective as it otherwise could be.
Do you have any specific examples of how communities have engaged with the CHNAs and how it's been used in general by the public?
I mean, CHNAs are as diverse as the communities they focus on, but again, they all require community participation as part of the process. And so that participation can look very, very different. It can be contributing insights through focus groups and surveys, serving on CHNA related advisory boards, participating as data collectors or data analyzers, functioning as envoys to local community boards, local community groups to gather more input and report back findings, or ideally, kind of the platonic ideal of a CHNA, to co-design the entire CHNA process alongside public health and healthcare leaders. And I know many of those engagement methods are part of the University of Minnesota Medical Center's CHNA process.
Okay. And if community members want to know a little bit more about their local CHNAs, where should they look for information?
Well, importantly, it's not just not-for-profit hospitals that are required to conduct CHNAs. Public health departments have a similar mandate, as do certain community health centers or federally qualified health centers. So given where you live, there might be multiple CHNAs to explore, or in a better case scenario, a single CHNA on which multiple organizations have teamed up. For not-for-profit hospitals, part of the Affordable Care Act's requirement demands that once that CHNA is approved, that it be made publicly available on a website. So that means that if you go to your local not-for-profit hospital's webpage and you search needs assessment or community health, it should pop right up. CHNA information is also reported directly to the Internal Revenue Service in publicly available documents, but going to your hospital's website is probably the easier route. And public health departments, of course, post all kinds of population and community level data on their website. So those two are another important source of great information on community health.
Great, thank you. Thank you for meeting with us, Philip.
Thank you, Clarissa.